Good evening, Nigeria, and welcome to Politics on Sunday. I am your host, Femi Akonde, and today we have a very important topic to discuss, and that is primary health care in Nigeria. But before we begin, let's give you breaking news. Let's inform you that just moments ago, President Bola Tinubu handed over as ECOWAS chairman to Sierra Leone's President Julius Maada Bio at the 67th ECOWAS Heads of State and Government Summit holding in Abuja, Nigeria's federal capital. President Bola Tinubu was first elected ECOWAS chairman on July 9th, 2023 in Guinea-Bissau and re-elected on July 7th, 2024 in Abuja. During President Bola Tinubu's valedictory speech, he talked to ECOWAS leaders on the importance of regional integration, but he also raised some complaints, especially on the ECOWAS standby force, which was activated under his leadership as chairman of ECOWAS. He wondered why, the ECOWAS standby force has not is not yet operational. He says ECOWAS standby force must move from the concept to operational reality. That he's a bit worried about the slow pace of its activation, which is taking longer than desired, and he called on ECOWAS leaders to act decisively to operationalize the ECOWAS standby force on the fight against terrorism to serve as an instrument for peace and stability in the region. Well, now to our main focus tonight. With public health care being of utmost importance to every nation's growth and development, establishing an efficient primary health care system is vital. Today, we have the honor of speaking with a leader who is at the forefront of this effort in Nigeria. As we delve into our discussion, we will explore the crucial role that primary health care plays in reshaping health outcomes across Nigeria. We will also touch upon various challenges the sector faces, the government's commitment to reform, and the innovative strategies being implemented to ensure that quality healthcare services are accessible and equitable for everyone, especially in rural communities. We will also discuss the impact of recent policies and programs, as well as collaboration between government and non-governmental organizations to strengthen the primary healthcare system. Well, our guest is the Executive Secretary of the Nigeria Primary Healthcare Development Agency, Dr. Muyiwa Aino. Thank you so much for joining us on the program today, sir.
Thank you, Femi.
It's a pleasure.
I'm glad to be here.
Thank you, sir. Well, let's start with access to healthcare in Nigeria, and I would like you to look at this from, measuring the impact of the Vulnerable Group Fund, this initiative of the administration to remove financial barriers to healthcare for people with disabilities, pregnant women, the indigent, and other vulnerable groups. How successful has this particular initiative been, and how has Nigerians, especially those in underserved communities, been able to subscribe to this initiative?
Thank you very much for that question, Femi. I think just a little bit of context is that given President Tinubu's commitment to Nigerians to make sure that every single one of us can access basic health care, essential care that we need, and to promote our well-being. He has really pushed the health sector, led by the two ministers, Coordinating Minister Mohammed Pate and the Minister of State, Dr. Ishiak Salako, to do a number of things. One of them, of course, is to improve the healthcare infrastructure, which I hope we will have some time to speak more about. But the other bit is to address a particular challenge that Nigerians face, which is the cost of healthcare. Even as we drive to improve the supply, there are still costs that are associated with healthcare services, including basic healthcare services. And many times that's a challenge for Nigerians. So there are several things that the government of President Tinubu is doing. The Vulnerable Group Fund, VGF, is one of them. And what it does is to provide insurance against what we call a minimum service care package for the most vulnerable amongst us. You mentioned some of the categories: pregnant women, children that are orphaned, displaced, internally displaced people, people with chronic condition, disabilities, yes, disabled patients. So, and what has happened is that in the first year that we started to drive the reform, 4 million Nigerians were newly enrolled on insurance in this program. If you consider that in the 2 decades that the the push has started, only 16 million Nigerians have been enrolled so far.
And within 2 years?
Within 1 year, actually.
1 year, 4.4 million.
Yes, over 4 million.
Okay,
actually.
so 4.2.
Yes, it's 4.2 million, but just rounding it up. So if we continue at that pace, the narrative starts to change. And it's not, we're far from where we need to be. We're not, Nigerians there's maybe 20, 30 million Nigerians that we need to reach before we can say we're comfortable. But, we have started on a journey, and the president's leadership is really pushing us through. But I want to mention a few other things that the government is also doing. There are certain conditions that are chronic conditions that the cost of care can be catastrophic for even those of us that are not exactly vulnerable on a good day. Cancer care, for example, we know how costly that can be. People with chronic renal diseases, certain other conditions like sickle cell disease. And the president, out of his compassion for Nigerians, also established the Catastrophic Health Fund. And in 2025, 25 billion naira was put in the budget for that. What that means is that Nigerians can access this money to pay for catastrophic health care, to avoid healthcare, to avoid them going into bankruptcy because they have to face some of these challenges. There's also the fistula care program. A particularly neglected group of women amongst us, women who have suffered complications of difficult labor in the past, what we call obstetric fistula. They're all over the country, more in certain parts of the country. They're neglected, they're stigmatized. Imagine when a woman, a wife, a mother is leaking urine in a way that she cannot control. So the stench, the odor, they've suffered quite a bit. And for the first time, the president established the fistula care program. And as I speak with you, 17 centers across the country are repairing these conditions free for women. And as of today, or as of the last time I had the data, 2,600 women across Nigeria. This is transforming the lives of these women. These are women who hitherto they will only remain in their house. They could not go to work. They could not go to the market. They could not even take their children to school because of the condition. But now with surgical intervention in these 17 fistula centers, they are now being fixed. There are many other things, but I'm getting a nudge from you.
There's also the 1.7 billion Hope Fund for human capital and healthcare delivery, which is a reference point for ways in which Nigeria has been stimulated to mobilize domestic resources. Now, is this fund actually making a significant difference in the primary healthcare development?
The Project Hope, the short answer is yes, it will. It's getting started now. But I want to say a little bit more. Project Hope spans 2025 to 2027. There's 3 components to that. There's the governance structure component, which addresses structural upstream components of health and education, things around the workforce, things around governance and accountability to improve it there. There's then the Hope Health, which focuses on improving access to primary health care. And then there's Hope Education that focuses on quality and access to basic education. On the Hope Health bit, it is structured as disbursements linked indicators, DLIs to states, where money will be given to subnational units, states and local governments, to incentivize investment. You talked about mobilizing domestic resources for healthcare. So the idea is to incentivize investment of government resources by states and by local government. So if you are able to improve the quality of your primary health centers, you get some money for that. If you are able to guarantee available stock of basic essential commodities, and we have 5 tracer commodities that we will be measuring, you get paid for that. So you have to do that first. You have to achieve that result first. If you are able to achieve coverage of certain critical interventions that speak to the priorities that the government has identified, skilled birth attendants, immunization program, you get paid for that. And because the first year of the program is just kicking off, the states are already driving hard. So when you've heard me talk a lot to say, we have, together with the subnational units, revitalized over 1,000, now almost 1,160 something facilities. Yeah. It's because the states are eager to meet the criteria to earn the DLIs. In part, of course, the governors and the states themselves are also committed, many of them, to the care of their people. But I think this is also an added incentive that Project Hope is offering.
Just recently, more than 700 health accountability officers were appointed by the federal government, and this is expected to strengthen healthcare delivery, especially at the primary healthcare level. Now, let's talk about health infrastructure, as a central focus now. How has it been, and what's the latest on the rehabilitation of primary healthcare centers across the country?
When this government started, we looked at even the best. There's something we call the Basic Healthcare Provision Fund, which is the core financing mechanisms for primary healthcare services. And historically, following the passage of the National Health Act, money has been sent through 4 gateways to the subnational units. And from the primary healthcare, National Primary Healthcare Development Agency gateway, 8,406 PHCs were receiving funds directly quarterly. We looked at this, and only 1/5 of them met the quality that was required for basic services. So, the minister reached out.
That would be what number in particular out of 8,000?
That was about 1,700 plus, or just about 1,800 out of 8,000, about 1/5 of that. And that was not good enough. So the president gave us a task to say, in 4 years, can we increase the number to at least 1 per ward that meets what we call level 2, and then make sure there are basic healthcare provision facilities that are at least 17,600 across the country. What level 2 means is that the basic infrastructure, the buildings, the roof, the windows, the basic equipment that you need, the basic health workers that you need. So you have a minimum number of what we call skilled bath attendants that allow a woman to safely walk into the facility and get delivered is available.
Dr.
Yes.
I would just like you to hold that a bit. We just need to go on this quick commercial break. When we return, we'll talk more about the primary healthcare sector in Nigeria and efforts of the federal government in developing this crucial aspect of healthcare delivery. Well, don't go. We'll be right back after this short commercial. Welcome back. My guest is still Dr. Muyiwa Aina, Executive Secretary and CEO of the Nigerian Primary Healthcare Development Agency. We're talking about primary healthcare facilities, and the upgrade that is currently ongoing. Just continue from that.
Thank you, Femi. So like I was saying, once we embarked on this journey, of course, the federal government, through the President's Health Sector Renewal Investment Initiative, is doing this in collaboration with subnational units, with states and LGS. I think it's very, very important to emphasize that. And in the time that we've started, which is about in the past year, 1,160 plus additional PHCs, in addition to the ones that were existing before, have now been upgraded to level 2. Many of them are now, they have the infrastructure, the equipment is now being installed and distributed, because you have to complete the physical structure before you put in the equipment. And a lot of the states are recruiting health workers, to fill the gaps, to make sure that they meet that bar. Again, so that one, Nigerians can feel the impact of government, but also two, so that they can earn the DLIs from Project Hope.
Okay, well, under the leadership of the Minister of Health and coordinating Minister of Health and Social Welfare, Professor Pate, and also your own leadership in the primary healthcare sector, we've seen a bit of reform, of course, and it's still ongoing. How does this major counterpart funding mechanism restructure to suit the needs of Nigerians who feel that their states and localities do not prioritize health investment as they should?
I believe you are referring to the Basic Healthcare Provision Fund. Yes. One of the things that we met was that the disbursement of the Basic Healthcare Provision Fund was not as regular or transparent as it was intended to be. So what we have done since we got on is a number of reforms. One is to look at the gaps in accountability. Two, to make sure that the money is restructured in a way that more money gets to the facilities for their operations. So you have putting on the lights in the facility, hiring ad hoc workers and all of that. It used to be that every facility got 300,750 naira per quarter. In the second phase of BHCPF 2.0, as we're calling it, each facility will now get either 600,000 or 800,000, depending on how many patients they see. So the higher volume facilities will get more. One of the other things that is also happening is that for the first time in the history of the Basic Healthcare Provision Fund, the Ministerial Oversight Committee that is headed by the minister has met regularly every quarter, since the advent of this government, and made important decisions, including disbursements, which is making sure there's oversight, there's accountability, and there's release. Also, because again, historically, there was evidence of leakages. I mean, there was once, it used to be that money would get to a facility and you couldn't really pinpoint in many instances what the money was being used for. We are now rolling out a PHC financial management app, which is basically a tool that will be in each facility that will track the disbursement, what monies they receive, and what they use it for. Eventually, it will be linked to the bank accounts of the facilities so that you can check directly. So that the notion of a health worker withdrawing a large sums of money and claiming to use it for things that you cannot necessarily verify is ending. You also mentioned the health fellows,
Yeah, I was going to ask, they were recruited. Yes. Have they started to oversee the process of quality service delivery and accountability?
Yes, indeed. About a couple of months ago, Mr. President had inaugurated the first cohort of 774 health fellows, which are young Nigerians that are developing leadership skills in public health, one per local government. So they are everywhere in this country. I should say, in addition to that, specifically to support the Basic Healthcare Provision Fund, we have also recruited and deployed another 774 PFMOs, Performance and Financial Management Officers. And what we are doing is that within each local government, the pair of the health fellow and the PFMO are working with the facilities to build their capacity to track the funds that are being disbursed to the facilities, to support some of the basic skills gaps, also depending on the background of the PFMO of the health fellow within each facility. So they're already in the field, they're already working. The PFMO started a bit after the health fellows, but they're in the field as we speak.
Yes, how during COVID-19, there was a lot of concentration on tackling or flattening the curve of the virus, and this took away attention from other some preventable and even vaccine preventable diseases. How have we been able to close this gap over time? I know it's a global problem, not just peculiar to Nigeria now.
Yeah, I think that you're right. COVID-19 really changed a lot of things, because when you have an emergency, you move towards the emergency, and we in fact saw a slight deepening of our routine immunization and other routine primary healthcare services interventions. But what has happened is that the government in the last couple of years has focused on taking immunization, for example, what we call the big catch-up. The implication of the COVID-19 gap is that there were children that were missed that should not have missed, and they grew past the age that we would normally target within the primary health centers or with part of the routine immunization program. So what the big catch-up program is doing right now, and I forget the numbers off the top of my head, but we're targeting all of the routine immunization antigens, and I believe more than 3 or 4 million children have been reached that are between the ages of 2 and 5, with vaccines that they missed during that period. We're also looking at zero-dose locations, which are locations where there are many clusters of children that have never been immunized because they are being missed out for many reasons. Either because there were security issues, or because they just never had a facility, or health workers or the campaign programs kept missing them. We have identified these locations. Most of them are concentrated in the north, and we have specific interventions. We're now listing children to say, who are the children that have been missed, where do they live, who are their parents, what are their contacts, and going after them one by one to make sure that we catch up on the vaccination program. And we do hope that by the time we do a check of the vaccination program, we do hope and expect to see an increase.
Yes, and then also, where are we with, vaccine management in terms of, production, storage, and the whole value chain around that? I know that at some point Nigeria also moved towards vaccine production. We also got some facility for storage of some of these vaccines.
Yes.
How robust is the system?
I think, one of the pillars of the health sector strategy that is being led by the coordinating minister for health is really the healthcare value chain, strengthening the healthcare value chain. And vaccines, along with other commodities, the same is true for HIV commodities, for TB commodities, for malaria commodities, are very important to have in the front line in a guaranteed way so that when they are needed, they are available. So there are a number of things that we have done. For vaccines in particular, you also need a cold chain system to transport it, So in the time that I've been at NPHCDA, through the leadership of Mr. President and the goodwill and support of our international partners, we have identified an additional 1,657 wards where there were cold chain equipment, and we have procured right now. They will start to deliver them actually from the end of June, solar refrigerators that can keep the vaccines in the state that are necessary. Nationally as well, we had to expand our storage at the level of the federal government. So we have 3 hubs now, one in Lagos that is just about to be completed. We also have our partners, Gavi, UNICEF, supporting us with a hub in Kano and one hub in Abuja. Yes, so also for the immunization program in particular, one of the things that we are doing is improving the quality of our campaigns. For one of the reasons why we keep having outbreaks is because we have low routine immunization. So as we are improving routine immunization coverage, we are also responding to outbreaks. In the last 1 year, we have combated cholera outbreaks and prevented cholera outbreaks with vaccination. We have controlled diphtheria outbreaks in 8 states in the last year. The Mpox outbreak that is happening in several states, we are now immunizing health workers and other at-risk people. The malaria vaccine is now being introduced in Kebbi State and Bayelsa to start with. We will expand, but we want to learn because these are expensive commodities and it's new to our system. The human papilloma virus vaccine as well is one of the most important things that we have done in the vaccination program under President Tinubu, where more than 14 million children have been vaccinated against the virus that causes cervical cancer, which means these girls, and it's lifelong protection, these girls no longer have to worry about cervical cancer, and it's all over the country, in every state, every corner. Nigerian girls aged 9 to 14, are now receiving the vaccine. It's now part of the routine immunization program as well. Yeah.
Yes, this year, 2025, looking at the budget, it was the highest budgetary allocation for the Ministry of Health so far in Nigeria's history, and people expect a lot from this sector, not just primary healthcare, including secondary and tertiary. But, speaking about these efforts in improving healthcare delivery in Nigeria, how has this significantly, should I say, reduced or impacted on data or statistics, which, some people say Nigeria still carries a disproportionately large share of the global maternal and mortality burden, contributing a significant percentage to global maternal deaths. Has there been any improvement with all of this renewed effort so far?
So you asked 2 questions. I'll take them one by one. I think if you look at the trajectory in the budgeting, the amount of money that is appropriated to the health sector generally, but even to primary health care within that, I think it's testament to the president's real commitment to making sure that we have what we need, at least as much as is possible within the prevailing circumstances to provide basic health care for all Nigerians. So the increase in budget didn't just start in 2025. In 2024, there was a major increase, over 2023. And that's why we were able to do all of the things that we're talking about, whether it is the recruitment of health fellows or the PhD revitalization or the establishment of 6 cancer centers in federal teaching hospitals or the medical missions that are happening all over the country just to do outreaches to people that are not able to, that have not been able to access healthcare historically, or the Vulnerable Group Fund, the expansion of the VGF that you talked about. So that has enabled us to start a journey. And my belief is that the further growth of the budget in 2025 will still build on that. You spoke about the maternal mortality.
30 seconds, sir.
Okay. So the government is implementing the maternal mortality reduction innovation and initiative, MAMI. And what that is doing is we have now identified the 172 local governments across the country that account for more than half, 55% of maternal deaths, because this is something that the president asked us to tackle head on, and we're following them, identifying the women, following them through the pregnancy, making sure they have access to the diagnostics, the medicines, the risk profiling, so that those that need to access emergency or obstetric care are getting it. And over 4,600 women have already received free cesarean sections as part of the program.
Oh, that's interesting. Well, Dr. Muyi, is it Muyi or Muyiwa?
Muyi, both.
Okay, Dr. Muyi, Executive Director, I said Executive Secretary earlier, I beg your pardon. Executive Director and Chief Executive Officer of the Nigeria Primary Healthcare Development Agency. It was a pleasure speaking with you, sir, and thank you for shedding light on activities going on in the healthcare sector. Well, that's all on the program today. You can watch this episode again on TVC News YouTube channel. Thank you for watching. I am Femi Akonde. See you next time.